So good morning everybody. Today I am going to speak about nephrology. The nephrology, the term deals with nephrology is a branch of medicine which deals with diseases of the kidney. Many people are actually confused when to go to a specialist, which aspect will come to a specialist of particular disease. Whenever they are told to have a disease, they will be confused which specialty doctor they should go to. For example, if somebody gets a small kidney stone, they'll get worried whether to go to a nephrologist or a urologist. They don't know the difference between a urology and a nephrology. As such, many of the specialities in medical sciences, the people will get confused between the specialty and the terminologies. So, most of the people being laymen, they need not really understand, they need not really know what a particular specialty deals with. Though it looks as if the kidney is dealt by two branches called urology and nephrology, the people are often confused which one is actually deals with what and what kind of disorders they deal with. So, nephrology and urology, both the branches are related to kidney only, but urology deals with the surgical aspects of the kidney and nephrology deals with the medical aspects of the kidney. Then the confusion comes, which one actually is the medical aspect, which one is the surgical aspect. Some of the things they look as if they are surgical oriented, but it can be treated by the nephrologist. Some of them are medical oriented. So, for example, if you get a renal stone and a pain, then you are supposed to go to the urologist who can treat you with a drug therapy, but still you go to a nephrologist with the confusion. But the nephrologist will deal with the kidney diseases, not with the kidney stone alone. So, that is why there is a confusion between the medical and the surgical. But whatever said and done, if you have any problem related to the kidney, you can go to the nephrologist initially, then go to the surgeon called urologist whenever he refers you to the urologist related to particular surgical intervention whenever you require. Nephrology and urology are the two branches, both of them deal with the kidney, but nephrology deals with the medical aspects of the kidney diseases, surgical aspects will be dealt by the urologist. So, this is the basically grossly the difference between the urology and nephrology, which often the patients get confused about. Nephrology deals with the kidney diseases. Kidney is a beautiful structure in the human body which does lot of activities inside the human body, and kidney is a specialized organ. It is probably the lowermost organ in the hierarchy of all the organs, the internal organs in the human body, like brain, heart, liver, spleen, then followed by the kidney and followed by the genital organs. So, kidney is a structure which is of a fist sized structure which is there in the back of the body, nearer to at this junction between the upper thoracic, upper abdomen and the chest, which is on the back, which is adjacent to the spine. The spine of the human body is actually supported by a bulky and a dense muscular structure, and at the junction between the thorax, that is the chest, and also the low abdomen, there is a small area where both the kidneys are placed. There are two kidneys in the human body, but need not be every time there can be two kidneys. There can be only one kidney also to start with and to begin with in our life, but ideally a healthy human body is supposed to have two kidneys. There are two kidneys separated in utero when we are within the womb itself. Both the kidneys are separated and kept side by side in the upper part of the abdomen on the back, not in the front. On the back there are two kidneys, and both the kidneys are supposed to clean the blood and supposed to form the urine, and which is actually collected in a small system called pelvic ileal system. Then the pelvic ileal system drains through a small tube called ureter into a collecting system called urinary bladder. So, the kidney, the pelvic ileal system, the ureter and the urinary bladder, which is basically the structure of the kidney and its associated organs, how they function. So, the kidney is a fist sized, which is approximately of the fist size of the fist, and which is brown in color, and as you all know that it looks like a bean. That's why the kidney is a bean shaped organ in the human body. So, this has got a small cap which is called adrenal gland. So, adrenal gland and the kidney both work independently, but the activity sometimes can be associated, functions can be seen between the two organs. So, kidney has got two basic parts when you really cut and see inside. Kidney has got a cortex, which is the functional aspect of which has got a functional units of the kidney, and which drains into a part called medulla. Medulla does a different kind of a function. It in the middle part of the kidney has got a medulla, and which is surrounded by a cap like structure called cortex. Cortex has got functional units of the kidney. The functional units of the kidney are called as nephrons. Each nephron has got a few parts called glomerulus, the Bowman's capsule, the loop of Henle. The glomerulus is a blood vessel tuft It's a tuft of blood vessels, and which actually is the filtering unit of the kidney. And this tuft of blood vessels are broken up into small arterioles called afferent arterioles and efferent arterioles, which come together to form a tuft called glomerulus. In fact, a major blood vessel in the human body gets into a smaller and further smaller functional units called arterioles. The arterioles become further and conglomerate. They conglomerate and they come together to form a tuft of blood vessels called glomerulus. And this is the glomerulus which actually filters the blood. And then this particular blood which is filtered and comes out, what comes out is actually the urine. So urine gets collected in a small cup-shaped structure called Bowman's capsule. From here, the loop of Henle starts. After the Bowman's capsule, the loop of Henle is a convoluted tubule. The tubule has got several parts. One is called the proximal convoluted tubule. In between the proximal and proximal convoluted tubule, and also the distal convoluted tubule. Between the proximal and distal convoluted tubule, you have a loop of Henle. Every structure in this particular nephron has got different varieties of activities. No two cells within the loop of Henle or the convoluted tubule has got a similar kind of function. That is why the kidney is a very, very complex organ. It is not so easy to say that the kidney does simply the passively a filtration process. It is not like that. Kidney has got varieties of and various kinds of cells which does several varieties of activities. So in that, the proximal convoluted tubule, then the urine comes into the loop of Henle, which is the descending loop of Henle, then the loop goes up called ascending loop of Henle, followed by the distal convoluted tubule, followed by a collecting duct. The urine takes several changes in the loop of Henle. That's why when the blood, 200 liters of blood is filtered, ultimately only 2 liters of urine only comes out. In fact, when the blood is filtered through the glomerulus, most of the blood which is filtered and becomes urine then comes out of the glomerulus and gets collected in the Bowman's capsule, then comes into the proximal convoluted tubule, then the loop of Henle, then the distal convoluted tubule. During the transit through this particular loop of Henle, etc., it undergoes several changes. One such thing is actually whatever is required by the human body, it takes into. That's what. For example, if you take lot of salt, the salt component is supposed to get filtered. Once it gets filtered, the loop of Henle does in such a way that whatever is the excess salt will be thrown out into the urine. And for example, you take lot of potassium. The potassium is thrown out in the urine by the mechanism which takes place within the loop of Henle. In the similar fashion, whatever is excess in the human body will be removed and thrown out in the form of urine, and whatever is less in the human body will be preserved and taken into the human body through the activity that is taking place at the loop of Henle. For example, you don't drink much water in a day, which is a sunny day, and you do a lot of shopping and you roam around and ultimately you forget to drink water. Naturally, there will be less filtration. When a kidney senses that there is less filtration, the less water in the human body, what it does is that with the activity at the loop of Henle, it retains the water so that you will not get much dehydrated, you will not collapse with a lack of water. On the contrary, if you drink lot of water, what it does is that it's through the special mechanism which takes place at the distal convoluted tubule with the help of a hormone called antidiuretic hormone, which activity gets changed according to your thirst and according to your drinking capacities. Whatever is required by the human body, it takes in. Whatever is not required, it throws out in the form of urine. So more urine you will pass if you drink more water. That's simply a simple mechanism. But remember, kidney doesn't do this activity so passively. It's not something like simply pouring a water into a glass. It's not simple activity like that. It is a specialized mechanism that takes place within the loop of Henle, so that we can conserve the water, we can preserve the water, or when it is in excess, we can throw the excess water or any substance for that matter out in the form of urine. So kidney does a specialized activity here. So once the urine gets collected into the collected tubule, then it comes out through the papilla. It gets drop by drop into the pelvic calyceal system, which is just outside the kidney. So kidney is just only where that collecting duct ends, then followed by a structure which itself is something like a hand-shaped kind of a structure called pelvic calyceal system. This collects all the urine through the specialized mechanism called peristaltic movement. It gets into the ureter. The ureter is a small long tube which transmits the urine from the pelvic calyceal system into the urinary bladder. So this particular ureter, there are two ureters on both the sides. Both the ureters open into a round globular structure which is there in the front of the body, in the middle, in the lower part, where you feel a sense of urination or excess urine in the body. So that is called urinary bladder.